The following is an instructional video on accurate spinal analysis for chiropractors holding a first degree.
Again, I'm back with you to continue with accurate spinal analysis. The last time I did a preliminary approach to analyzing the cervical curve. There's much more and a whole lot more needs to be done with respect to that analysis. But that was just a preliminary preparatory approach to analyzing the cervical curve and that the practicing chiropractor must use. Today I'm going to focus in on the thoracolumbar region. And here on my view box, you would see the thoracic region. And what I am looking for here, basically rotations of the spinous processes, the size of the heart to see if I have to refer this patient, to see if the diaphragms are depressed or elevated, and again to look at listings, scoliosis, open wedges, and so forth. The other film I'm going to put up deals with the lumbosacral region. I would not have attempted to focus so much on the thoracic region at this point, but later on we will. This lateral view of the lumbosacral region shows up a number of things. One, it shows the sacrum, L5, L4, L3, L2, L1. And it shows some of the IVFs, the intraventricular foramens through which the nerve passes to innervate the body. Down at the bottom here, I found that the lumbosacral angle is 28 degrees. And the Ferguson gravitational line that runs from L3 and that bisects the sacrum is within normal limits. And I've also found that the lumbar curve is within normal limits. It is 70 degrees, and so it's normal. At the bottom of this chart here, this X-ray, and at the end plate of S1, which is sacrum, there's a line that runs through it that determines or helps the chiropractor to determine if this patient has what is referred to as a listhesis, depending on the anteriority or the movement of L5 on S1 or so forth. And so the almond line gives us that type of information. If L5 is anterior to S1 or if it runs posterior. The other film is a 14 by 17 A to P, and this one that we just looked at is lateral, 14 by 17. And so that the 14 by 17 A to P has a number of areas too that the chiropractor must identify. Firstly, he must identify if there are problems beneath these structures here. As we can see, the patient had an IVP recently, about a week or less ago, and the patient's spine has some rotations. Some of the vertebrae are going left, some are going right. I've also found after analysis that the left hip, which is this hip, and the right hip are disproportionate in their measurements. The left hip is PIN and the right hip is ASEX. Something else that this gives us is, again, the scoliosis. And we have to look here to see if there's an open wedge and where the spinuses have gone. Of course, for analysis purposes and adjustment purposes, the wedges and the spinuses give the chiropractor the sight, or insight if you will, or the ability to make a judgment and make his adjustment. And so, my name is Dr. Pelham McSween, and we've gone through the preliminary approach to accurate spinal analysis from the cervical region. And today we have just we've briefly scratched the surface of the thoracolumbar region. Until I see you, bye.
This video is designed to instruct chiropractors holding a first degree on accurate spinal analysis. For further information or to obtain copies of this video, call 1473-439-6334 or 405-6334.